Dear students, today I'll take up about the rehabilitation of hearing handicap. For any disease, the treatment is specific, general, symptomatic, prophylactic, and rehabilitative. Rehabilitation of the individual also is a part and parcel of the treatment by the physician. Now, the hearing handicapped individual can be benefited by medication or surgery and rehabilitation by suitable device, that is commonly hearing aid. Hearing aid is a device by means of which the sounds are amplified and projected to the ear so that the individual can overcome his hearing handicap. Now, a conventional hearing aid, all of you must have seen, it has got a microphone, an amplifier, and a receiver. A microphone to catch the sound energy, sound waves, and make it into electrical energy, and an amplifier to enhance them, to make them louder, and a receiver so that these sounds are presented to the ear. These are the three parts of the hearing aid. Now, what are the different types of hearing aids? There may be air conditioner hearing aids, which are commonly used. The other variety are bone conduction hearing aids. When do we use bone conduction hearing aids? Suppose the ear is discharging. You keep a hearing aid inside the ear, the hearing aid gets damaged, and also the ear problem gets worsened because the discharge is coming out, it gets accumulated there, and there will be more infection and more discharge and pain and so on. So, in such situation, people use bone conduction hearing aid. Hearing aid will be present here so that the sound vibrations directly stimulate the cochlea by bone vibration, that is by bone conduction. Now, the conventional hearing aid, which we see day in and day out, has got a microphone and an amplifier and receiver, which is a body worn. You must have seen these pocket model hearing aids, which are becoming outdated nowadays. It has two wires or one wire, which leads to an aid inside. Nobody likes it. Even the oldest person also doesn't like it because of the stigma attached. But still, they are very useful in case of children, small children. And it is very important to use these type of hearing aids in case of severe deafness. Now, the second variety is behind the ear type. This is very commonly used nowadays. The hearing aid will be put just behind the pinna, and there is a small tubing which will be running from the ear to the external canal, wherein the ear mold will be there and the sounds are presented to the external canal. This is very popular now. This is called BTE, that is behind the ear type. Suppose due to some reason or other, people don't like to use a hearing. The problem with hearing aid is we can very, very happily and very comfortably wear a spectacle whenever there is a presbyocusis, a presbyopia, or even the other thing, that is myopia. But when it comes to hearing aid, nobody likes to use it because of the stigma attached, as I mentioned earlier. That is why the spectacle hearing aids, they have come into place. The spectacle hearing aid is just like a spectacle which normally the individual uses for his correction of his visual defect. And at the end of this spectacle frame, the hearing aid is attached, which exactly sits on the mastoid bone. So this is spectacle type of hearing aids, which are very popular at some time. Now, again, they are not very popular because of the advances. The advances in the hearing aid technology is so much, it is threatening the surgery also. Even for some surgical problems also, people opt for a hearing aid. Why unnecessarily subjecting the body for the surgery, surgical trauma? It is a non-invasive procedure. So even though they are expensive, people go for hearing aids now. That is why the other variety is in the ear type. In the ear type, that is, there will be the hearing aid will be there. It is kept directly in the ear. It is seen here. So it is comparatively smaller in size. The advantage of this particular smaller size hearing aids is, especially in women, they can cover it with the hair. If men also, if they grow hair and cover it, nobody knows that the individual is using a hearing aid. And more advanced are canal type hearing aids. That is ITC, CIC. ITC is in the canal hearing aids. CIC is completely in the canal hearing aids. I think in last classes, I have shown a picture of the ex-US President Bill Clinton. He used one hearing aid on both sides, hearing aids in both ears. The whole world doesn't know that he's suffering from hearing loss and used hearing aids in both ears. Nobody knows it. It is exactly inside the canal, completely the canal. You can see the pictures here. You can see here, this is the widely popular model that is called behind the ear type. Behind the ear type of hearing aids. Receiver in the canal. The receiver, this is small receiver will be there. That is put inside the ear canal. Now, see, you can see this. These are the in the canal hearing aids. These are the in the canal hearing aid, just like a button. They'll be there. They are in the canal hearing aids. These are all. But there are what are known as invisible in the canal. See, these are the hearing aids which are very expensive but very, very popular. See, hardly there you will see anything. The small projection will be there, by means of which you have to manipulate it. This will go into the hairs of the external canal and nobody knows it, nobody recognizes it. This is the completely in the canal or IIC, invisible in the canal. Now, what are the considerations we have to uh, observe before prescribing a hearing aid? We have to see whether the ear canal is suitable or not. For effectiveness of hearing aid, the ear canal should be wide and the skin should be healthy. And there should not be any infection, otitis externa or otitis media. And even the post-auricular skin also should be healthy. And not only that, the patient should be able to accept it. Patient should show interest for amplification of his hearing and using a hearing aid. Hearing aid is very useful as far as the conductive deafness is concerned. But as far as the sensory neural deafness is concerned, it is not of very great use. Even though there is amplification, it is not of very great use. It may be of marginal benefit, sometimes even counterproductive. So if the patient is explained all these issues, he would accept it. And patient should have dexterity to handle it, to remove it, to replace it, and to tune it, and to replace. So he should be able to do it. All these, the ear canal skin should be free of wax, and the ear canal skin should not be very sensitive. And patient should be able to manage or understand the acoustic feedback. What is acoustic feedback? Acoustic feedback is the sound vibrations which are produced in the ear. If there is a small leak, they get they come out of it and produce some disturbance. So this is acoustic feedback. This patient should understand and avoid it. There are several issues we have to consider before prescribing a hearing aid. Now, what are the disadvantages? As I already mentioned, this is cosmosis. It's a great stigma that is attached, not only for hearing aid, for the deafness, entire deafness as a whole. There is a lot of stigma. People do not sympathize, like in case of blindness or in case of a lame person. Moreover, if an individual is deaf, people will make fun out of him. So he will be put to lot of shame and lot of discouragement, and he will be uh, he will be insulted from time to time, and it is very, very difficult. It will have a lot of psychological impact on the patient's mind, and the patient cannot do well in his life, in his studies, in his family. So nobody will take care of him, nobody will take him seriously. These are the various issues, and the society also will be subjected to ridicule, and he will be harassed, and things like that. So this is a great disadvantage. If an individual is wears a hearing aid, everybody will knows that the individual is having hearing loss. That is why people try to manage it without using a hearing aid. And wax issues. Suppose individual, this wax, as you know, it is a colorless, odorless liquid, water liquid, which is secreted by the cerebrous glands, which are modified sweat glands present in the extrinsic canal. So without our knowledge, wax flows out. But in certain genetically prone individuals, the gets accumulated, especially when the ear canal is tortuous. So in such individuals, frequently wax gets accumulated, and frequently when the patient uses a hearing aid, it will produce a very negative effect. And not only that, this is most important aspect of a hearing aid, that is occlusion effect. What is occlusion effect? Occlusion effect is feeling of something present inside the ear canal. Always patient feels the ear canal is blocked by something, some foreign material like that. This is the occlusion effect. It will take a long time for the patient to understand and accept it. It is a very great disadvantage of a hearing aid. And infection, and it can attract infections. Sometimes fungi might be invading, and patient may develop otitis externa. And in case of discharging ears, the hearing aids, as I already mentioned, it is very, very counterproductive, or it is not at all accepted. There is one type of hearing aid called cross. What is cross? Cross is contralateral routing of signals. Suppose there is single-sided hearing loss, single-sided deafness. Then we make use of the normal ear. So patient be using the microphone in the deaf ear and the receiver in the better ear, so that in the better ear patient be hearing normally, but in the deaf ear also the sounds that come through the deaf ear also will be received by the uh, device inside the deaf ear, and they are carried into the normal ear by a wireless mechanism. So why this is important? This is important for the simple reason that we are all provided with binaural hearing. Why do we need a binaural hearing? One single ear is enough to hear, but binaural hearing is important to recognize the source of sound. You should know from where the sound is coming. Suppose there is a horn inside, horn behind, car horn or a bus horn that is blown behind you. You should know from where it is coming, from right side or left side. Unless you have a binaural hearing, this is not possible. So that is the greatest advantage of binaural hearing. So for binaural hearing, this cross technology, hearing aid technology has been introduced. Now there is one more latest technology that has come in, that is called BAHA. BAHA is bone anchored hearing aid. This is the BAHA device, BAHA package. This has got one titanium fixture, one abutment, and one sound processor. These are the three portions of a of this BAHA device. So this is the titanium fixture. By surgery, in case of adults, everything can be done in a single sitting. Whereas in children, they do usually in two stages. In the first stage, they'll introduce the fixture. This is the titanium fixture they use, and over that, after the wound everything gets matured and heals normally, then they'll apply the abutment over it, and over the abutment the sound processor can be used. The greatest advantage of BAHA, that is bone conduction, bone anchored hearing aid, is it is invisible. It is inside the hairline. Nobody knows that individual is using a hearing aid. Not only that, as it is bone anchored, the hearing sounds, um, the sound vibrations, they directly go into the, and that they vibrate the cochlea. Vibrate the cochlea, not only cochlea of the diseased side, cochlea of the normal side. When uh, it is felt in the normal side also, patient will be able to hear even the sounds coming from the diseased side. This is the, just like this cross, that is contralateral routing of signals technology in hearing aid. Now that cross is totally, it is it has become outdated, and this BAHA has come in force. So the candidacy criteria are discharging ears, where individuals cannot use a hearing aid inside the ear, and deformed ears, microtia, anasia. Suppose there is no ear canal at all, how can you use a hearing aid? In such individuals, BAHA is of great help. And conductive hearing loss, where surgery is contraindicated. Example, if there is otosclerosis and tympanosclerosis, both of them put together, you can't operate. Very risky. Patient may go in for sensory or hearing loss. And in case of single-sided deafness, this is of great use. And the greatest advantage of this BAHA is it eliminates the head shadow effect of the cross. In cross hearing aid, we'll have what is known as a head shadow effect. So some portion of the sound vibrations which we hear will be lost. Now surgery is a single stage in adults, and in child first stage is done, and the fixer is attached, titanium fixer, and after 6 months, when there is effective osseointegration, the greatest advantage of this one is it is made up of titanium, and titanium is very much famous for its osseointegration effect. It gets integrated into the bone very, very effectively. Implantable hearing aids, nowadays the implantable hearing aids are also being preferred in a great scale. Once again, for the same reason, they are invisible, they are very effective, and they are more natural. That is why they are preferred. In these, the mechanical vibrations are directly, they are transmitted to the ossicular chain. So there are two types of devices here, piezoelectric devices and electroacoustic hearing devices or electromagnetic hearing devices. So piezoelectric devices, they function in the principle that they have a piezoelectrical transducer with a ceramic crystal, which uh, increases its volume, and with the electrical stimulus, it gets vibrated, and the vibrations are passed on to the ossicles. These types of implant that are called Envoy and Tika. Tika is totally implantable cochlear amplifier. Due to some reason or other, this particular technology failed to take off. Next is the what is known as electromagnetic hearing devices or electroacoustic hearing. This is the electric current. It is passed into a coil that drives a magnet which is attached to the ossicle. Example is vibrant sound bridge. This is popular. Now the vibrant sound bridge, this is a picture of a vibrant sound bridge that is incorporated into the patient. It has two components, now external component and an internal component. External component has got an audio processor, and internal component has got an implanted coil and a conductor link, and there is what is known as FMT, that is floating mass transducer, which is attached to the incus. So audio processor is an external component which they use it over the skin. There is a magnetic relation between the external component and the implanted internal component. And once there is a sound that is caught in by the audio processor and it is transmitted to the implanted internal receiver, the sound vibrations are the electrical, they are prepared, they are changed into electrical impulses, electrical energy, and the energy is transmitted through the conductor link into the floating mass transducer, wherein because of the magnet, it oscillates and it vibrates. The vibrations are carried to the incus, through which the vibrations are carried to the stapes and the inner ear. This is the functioning of a vibrant sound bridge. Now, in whom this is useful? In individuals who are more than 18 years age with moderate to severe sensorineural hearing loss. And also patients who want to avoid an occlusion effect. They don't want to have anything inside the ear. They want the ear to be free. And in individuals who have got lot of wax, persistent wax formation, and individuals who don't want to have acoustic feedback, which I mentioned just now, they want to have a near normal hearing. In such individuals, the vibrant sound bridge is of great help. Surgery is, we have to do a mastectomy, and then you have to implant the receiver of the implant. We have to keep it in position, and then we have to do a posterior tympanotomy, just like in cochlear implant, and through that the link, the electrical link wire is introduced, and the FMT which is attached at the end of this particular wire is clipped to the long process of the incus. This is vibrant sound bridge. Next are the implants. In implants, this is the cochlear implant is the most important one, which we come across day in and day out. It has totally transformed the management of the sensory neural hearing loss. It is a great boon for the hearing handicapped individuals, especially in case of prelingual children. Who are prelingual children? Children who did not learn to speak. In children who did not have speech and language development because of deafness, they are called prelingual children. In individuals who lost hearing after learning speech, they are called postlingual patients. Postlingual children or postlingual adults. They are the individuals who lost hearing subsequently after learning speech. Now, in case of the best use of hearing implants is, the best candidates for hearing implant is a postlingual child. Postlingual child. Next best candidate is a prelingual child. And next is postlingual adult, also is a very, very useful. For them also it's very, very useful technology. Whereas for prelingual adults, it is not of great use. It's not of use. It helps the individual for awareness of sound. Patient can listen, but he cannot develop speech. He cannot understand speech. Only thing he can respond to a doorbell or a call or something, or a horn or something. In case of postlingual adults, that means adults who did not learn a speech at all. That is why it is most important to catch these individuals at a young stage. That means hearing loss should be recognized and diagnosed as early as possible for early rehabilitation. So how did the cochlear implant technology evolve? Since 1939, people tried to understand the various aspects of speech, and subsequently this DiGiorno and Iris, they tried to stimulate the cochlea directly, and they heard the sounds, and they described, they have put the implant in the ear and they are connected to the electrical stimulus. Then he wrote it as if there is a sound of a boiling water. As the sound appears when water boils, it was mimicking like that. Subsequent research has resulted in what is known as a single channel implant by this house group in 72. It was also very great advance at that time, and it has got FDA approval, and it has been used. It's only a single channel implant. This is various anatomical aspects. And the only problem with a single channel implant is patient will not be able to understand speech very effectively. That is why the multi-channel implants have come in now. Now, these are the various components of an implant. That is the multi-channel implants. They have revolutionized the management of sensory neural hearing loss. They have got an external component which is worn like a hearing aid, and an internal component which is inserted surgically in the ear. This is the external component, this is the internal component. Coming to the external component is called speech processor. The speech processor has got a microphone, and there is a magnet here, and a transmitting coil is otherwise known as transmitter or transmitting coil. This is worn externally, whereas the internal component has got an antenna with magnet and the receiver package is otherwise known receiver stimulator, which has got plate electrode and a ball electrode and a 22 electrode array, thin wire-like structures, wherein the electrodes are wound manually. So this is the structure of a cochlear implant. How do we introduce it? And how does it work? Let us go back. The sounds are heard through a microphone, and the speech processor works, and it synthesizes the speech, and it breaks them into electrical vibrations. And these electrical vibrations, they are passed through this magnet into the antenna and the magnet here. And from there, the vibrations, they are carried into the receiver stimulator, and through this electrode array, which has 22 electrodes, which is introduced into the basal turn of the cochlea. Which part of the basal turn of the cochlea especially? You know very well, there are three compartments: scala media, scala tympani, and scala vestibuli. You have to introduce into the scala tympani. Correctly, the scala tympani, if you introduce them, now they'll come in contact with the spiral ganglion cells, and the sound vibrations, they are stimulating the neural epithelium in the osseous spiral lamina. This is how a cochlear implant works. The single and multi-channel channel implants are there, and there are various types of speech processing strategies are there. There are various types of strategies which are employed by different companies. The nucleus out of that is most popular implant. This is an Australian-based company. This is called Cochlear. Cochlear company's name is Cochlear, based at Melbourne in Australia. Whereas the other next best company is Medal. Medal is in Innsbruck, Austria. Whereas the next best company, third best company is Advanced Bionic from California in United States of America. These three are the most popular cochlear implants. Now, the indigenous cochlear implant is also, that is the cochlear implant made in India, also is being readied very soon. They are very, very expensive. All these foreign cochlear implants, they are all imported cochlear implants, are very, very expensive. Minimum is 6 lakhs. So people devised cochlear implant indigenously inside India. It is ready, and it is in the final stage of trial, and anytime it will be available for the Indian patient. Now, what are the indications? Indications for cochlear implant are adults of 18 years or older. In fact, there is no limitation of age at all. You can operate even in case of 10 months child. In fact, the earlier you operate, the better will be the development of speech, as I mentioned in my last class. Unless the speech center is stimulated earliest, there will be loss of neuroplasticity, and that speech center area will be taken over by the nearby areas like visual cortex and all. And in case of adults and children who are suffering from bilateral severe to profound sensorineural hearing loss or greater, with no benefit with the most powerful hearing aids. As we all know, in case of severe to profound hearing loss, hearing aid is the most preferred device that we prefer. It is non-invasive, it is less expensive, very, very popular, stood the test of time. But it is not the case with one and all. Many people do not accept a hearing aid for the reasons just now I mentioned. And not only that, even the most powerful hearing aid also is not useful for all people. So cochlear implant is the answer for such individuals. And these people should be psychologically suitable, because cochlear implantation is not a simple surgery. It is the costliest surgery as on today in the country, commonly done. So lot of expenditure is involved, a lot of some risk is also involved, and lot of effort should be there in the from the part of the operating surgeon and his team and the family of the patient. It is a lifelong bond that is there between the individual and his and the surgical team. And there should not be any anatomical contraindications. That is, the inner ear should not be deformed, and patient should not be medically contraindicated. He should not have a problem, medical problem, which will like uncontrolled diabetes, uncontrolled hypertension, cardiac illness, renal disease. So these things will not be allowing for the individuals to get a cochlear implant done. It can be done provided they are all on control and patient is medically fit. In children, it is written as 12 months of older, but there are instances where even 6 months children, 6 months old children are implanted. Now in India, for 10 months is okay. And bilateral to severe to profound sensory hearing loss with the pure tone audiometry of 90 decibels or greater in the better ear. And no appreciable benefit with a hearing aid, and he must be well versed in wearing a hearing aid, and he should be ready for the post-operative auditory verbal therapy program. And parents should be very, very motivated. Patient should understand. Patient should have realistic expectations. Sir, you have done the operation, our child is not speaking at all. No. Child will not speak immediately. You should stimulate the speech. You have to give intense speech therapy for the child. As I am repeatedly mentioning, meningitis is a speech and hearing emergency due to labyrinthitis ossificans. Once patient is treated for meningitis, you have to keep speech and hearing also in mind, and immediate cochlear implantation has to be considered because of the complication of what is known as labyrinthitis ossificans. This is a very, very difficult issue. Even at the stage of labyrinthitis ossificans also we can do cochlear implant, but it's very laborious and it is not very promising as a normal cochlear implant. The contraindications are incomplete hearing loss. Nobody uses a cochlear implant in such instances as on today, but tomorrow's technology may be different. And neurofibromatosis, wherein the cochlear nerve is gone. The neurofibroma tumor is from the vestibular part of the eighth nerve. So when the nerve is not intact, your cochlear implant will not function. And mental retardation, psychosis, and organic brain dysfunction, unrealistic expectations, cochlear implantations of no use, and active middle disease, and Michael deformity, total aplasia of the inner ear, or small internal auditory canal, atresia of the eighth nerve, and dysplasia is not a contraindication, especially this Mondini deformity and all, it can be done. And canal wall down mastectomy also is a relative contraindication. We can do it. And labyrinthitis ossificans, as I just mentioned, and advanced autosclerosis also, cochlear implantation should be done with a lot of care. These are the CT findings of labyrinthitis ossificans secondary to meningitis. General workup should be done, audiological examination should be done with binaural amplification, CT scan should be done to study the bony temporal, bony findings in the temporal bone, whereas MRI should be done for study of the membranous cochlea, and a trial of the powerful hearing aid should be done, and a psychological evaluation done, and thorough medical checkup should be done, and thorough evaluation of his hearing loss should be done. Probably there is a syndrome, and pneumococcal vaccine should be given to prevent meningitis post-operatively, because you are operating on the inner ear. This is the surgical technique. We do a mastectomy. We do a simple mastectomy and open up the middle ear cavity by making a window in the posterior bony meatal wall. This is called posterior tympanotomy or facial recess approach. That is opening the middle ear cavity between the facial nerve and the chorda tympani nerve. Just in between, we'll make this opening and we'll identify the promontory and identify the round window. Either we have to we can introduce the 22 electrode array directly into the round window, or we'll make a cochleostomy just anterior to the round window and introduce it. And complication rate is very less. Wound infection can occur, but it can be managed. Sometimes facial nerve injury might occur. We should be careful. Seizures of leak may occur, meningitis may occur, and vertigo is reported in a lot of patients. Sometimes there is a device failure after surgery. You have to explant it, and reimplantation should be done. And usually MRI cannot be done once cochlear implantation is done, because there is a magnet in the cochlear implant. And post-operative rehabilitation is, once the surgery is over, wound is healed, after 3 weeks, switch on will be done. The implant will be switched on. Then there will be what is known as mapping. What is mapping? Mapping is tuning of various frequencies to the required intensity. So certain frequencies may be louder, certain frequencies may not be high. So that's all we'll calculate by means of the computer and tune it very, very carefully. And next is auditory verbal therapy. Once the implantation is done, especially in prelingual children, we have to give intensive speech therapy. Patients should understand the object, understand the lips, how they are moving, and listen to the speech. Now there is implant. So child will have a very good effective result as far as speech is concerned. if he is subjected to auditory verbal therapy. And different focus depends on patient's previous experience with sound. Yes. Now the goal is to enable the children to be able to learn passively from the environment, and program addresses receptive as well as expressive language skills. Generally, we encourage only one language so that child can be master it, and he'll be well versed with it. And we should have multidisciplinary dedicated group is necessary. The speech therapist, the audiologist, pediatrician, anesthesiologist, everybody, the psychologists, they become a group along with the ENT surgeon. Now, as far as the implantation is concerned, there will be a wide range of outcomes. Improvement in long term is very effective in most individuals, and the oral and oral education should be very important, and motivation of the parents also should be very important. And probably in future, totally implantable cochlear implant, that is TICI device, TICI, total implantable cochlear implants. So the so-called external component will not be there. Already it has come into vogue, but these individuals, they complain that his speech is not very clear. These are the soft array to minimize the damage to the inner ear while introducing. It has come, and probably stem cell therapy, once it is successful, it will help in a big way as far as these sensory neural deafness individuals are concerned. Now, once the individual who is having cochlear implant, he is definitely, he will be doing well. But if an individual has got a bilateral NF2, that is neurofibromatosis 2, on both sides, and there is bilateral profound sensory neural loss, a hearing aid will not be useful, and a cochlear implantation is also not useful. Why? An intact cochlear nerve is very important. Intact spiral ganglion cells are very important for a cochlear implantation to function. If they are not there, cochlear implantation is not used. Now, what is the answer? The answer is ABI. What is ABI? Auditory brainstem implant. ABI is auditory brainstem implant. Auditory brainstem implant is just like cochlear implant. Only difference is at the tip of the electrode array, there will be a diaphragm mesh. There will be a diaphragm mesh, like a small thin plate-like thing. Now, after surgery, after doing a craniotomy, mini craniotomy, this 22 channel implant with a diaphragm mesh is introduced into the lateral recess of the fourth ventricle, where we can directly stimulate the auditory lateral lemniscus and olivary nucleus of the auditory pathway. So this is auditory brainstem implant for individuals who do not have an intact nerve. Even though the technology is very great, the problems are, it is very expensive, almost about 15 lakhs and odd, even more than that. And the advantages are not as great as a cochlear implant. Now, apart from that, you have to assist the individuals who are having hearing impairment by means of various assistive listening devices. assisted listening devices means, suppose an individual is hearing impaired, he cannot hear a telephone ring and telephone sound speech. So we can introduce an amplifier in between so that the speech is amplified and heard loudly to the patient's ear. These types of assistive listening devices, they are of great help as far as the hearing handicapped individuals are concerned. And sometimes these devices may be alerting devices, like suppose a doorbell is rang, a patient will not be able to listen to sound. Then, along with the doorbell, they'll introduce a, a flash of light also. Once there is a flash of light also, immediately the patient will be alerted, especially in individuals who stay alone in a house. And sometimes there is they can employ a hearing dog. His pet dog will be tuned so that if there is a doorbell, immediately it will bark and it will see that the master gets up. Hearing dog is also employed. Uh, these are various technologies which they employ for assessment, for improvement of the his disability, for overcoming the disability of the individuals. So apart from that, the other modalities like visual or tactile sensations, the sign language. So if the patient is severely handicapped, then they will be taught with sign language. You must be having some idea. So with the simple signs, they can understand each other with the sign language. So the sign language is of very good help to the deaf community who are reluctant to have a normal hearing. It's a separate society, and they are very happy in their own society, in their own field. So these are all various aspects where hearing impaired individuals can be rehabilitated. Thank you.